So we're going to start talking about the physiologic response of stress on the body and how this leads to diabetes. So when you encounter a stressor or many stressors and you have ineffective coping leading to allostatic load, the brain is releasing chemical messengers to the adrenal gland, which is a small gland that sits on top of the kidneys. The adrenal cortex can release glucocorticoids. The main chemical would be cortisol. Cortisol can affect memory. It regulates memory. It regulates cognition, mood, sleep. And when you have an increase in cortisol, it can increase your glucose in your blood. It can increase amino acids and fatty acids. It can increase lipids in the blood. All of this happens when there is an excess of cortisol in the system. From the medulla gland, the medulla part of the adrenal gland, that can release something called catecholamines. Two types of catecholamines would be epinephrine and norepinephrine. When you have an excess of epinephrine in the system, it can increase blood flow to the heart. It can also increase cardiac output and increase contractility of the heart. It can decrease glucose uptake in the system and decrease insulin. When you have an excess of norepinephrine in the system, it constricts blood vessels, and all of this can lead to an increase in blood pressure, what we like to call hypertension. So putting all of this together, how does this lead to diabetes? Well, when you have an increase in stress, a chemical is released from the brain. It goes to the adrenal cortex and medulla. It can increase blood glucose. It decreases insulin production, and it also decreases the uptake of insulin within the system, creating that high blood sugar. And what are some coping skills that are effective for combating stress and anxiety? That would be to get exercise, like riding a bike, having a hobby such as swimming. You can try deep breathing exercises. They're kind of a relaxation exercise to decrease anxiety. So you take a deep breath in through your nose using your diaphragm and exhale slowly. You can try using a 4 count when you do that. So take a deep breath in and release for 4. You can try that a couple of times, and usually that will help to relieve acute anxiety. You can also try imagery, and you can try different forms of meditation. Yoga is a great exercise that you can use for relieving muscle tension and using some deep breathing skills. You can also change your environment around you to a more relaxing, calm environment. It decreases that stimulation for anxiety, and also you can change it for increasing your sleep, getting a better quality of sleep. You can also try music as well, has been helpful for improving quality of sleep and relieving signs and symptoms of anxiety and depression. So, I'll ask you a couple of questions and see what you know. Question 1. What is diabetes? Diabetes is the inability to produce insulin or to use the insulin that's produced effectively. Question 2, where is cortisol released? Cortisol is released from the adrenal cortex. Question number 3, where are catecholamines released? Catecholamines are released from the medulla part of the adrenal gland. Question number 4. Name 2 catecholamines that are released from the medulla of the adrenal gland. That would be epinephrine and norepinephrine. And question 5, list 2 effective coping skills that you are able to use during times of increased anxiety and stress. Some effective coping skills would be exercise, swimming, biking, yoga, meditation, imagery, deep breathing, and increasing your sleep, changing the environment around you to make it more calm, relaxing, and to decrease that stimuli. That's it for me.